thank you very much for joining me today. So if we could open up with your name and where you're from and your age.
Okay, my name is Carolyn. I'm from Edmonton area, and I'm 41.
Right on. So Carolyn, could you kind of explain to me what type of relationship you have with medical cannabis and kind of what brought you to that, or what brought you here today?
Okay, how far back do you want to go?
You can go back as far as you like.
Okay, well, the major reason why I started with cannabis is because I have debilitating mental health problems. They date back to now 16 years ago.
Mm-hmm.
I had high-functioning depression prior to that, but 16 years ago is when PTSD kind of took over my life. And so then fast forward for quite a few years of being on pharmaceutical medications and trying different treatments. Unknown, they didn't know I had PTSD. They didn't diagnose me with it.
Mm-hmm.
So we tried basically treatments for severe depression and anxiety. And then that fast forwards us up to 2016, where April 2016, I was formally diagnosed with PTSD retroactive.
Yeah.
And then shortly after that, I decided I'd volunteer at an event that was for to raise money for veterans suffering from PTSD. It was a Military Minds Inc. event, and because I wanted to meet more people with PTSD,
Mm-hmm.
and that's where I met Bryce, and he suggested that I look into cannabis.
Okay, so you're basically about 3 years-ish?
Well, 2.5. October 2016 is when the date I started.
Yeah. So October 2016, you decided to try medical cannabis as a treatment.
Yes.
For your own mental health issues and your PTSD.
Yes.
So, why was that? Why were you seeking something different?
Because everything else I had tried pharmaceutically and therapy-wise, was not working.
Mm-hmm.
I had hit a plateau probably about 7 years in, and then hit that, and then just started going down. And
Over the course of 16 years.
At that point, 14.
Yeah,
14 years.
Yeah. And so 7 years. The first 7 years,
I was making gains.
It was all right.
I'd overcome quite a bit in that time period,
Mm-hmm.
but then I hit a wall and I just started going down. I think it's because at that point, then I kind of lost hope.
Mm-hmm.
And so we tried different medications. There were severe side effects. And I was on exceptionally high doses of those medications. So It wasn't like we tried them for a little bit. The medications I was on, we needed... a general practitioner couldn't prescribe them at those levels. I needed to have a psychiatrist to prescribe them at the levels, and it was just they weren't effective. They were enough to keep me going, but in a zombie-like kind of state.
Okay.
Where I had no ambition, I had no goals. I was just basically waking up and going to sleep every day. Like that was it. I didn't go out and see friends. I didn't have a life, and we had tried one medication that ended up giving problems with my heart, so I had to go off of that.
Oh my gosh.
Well, it wasn't extensive problems, but it was they had indicated that there was some kind of heart arrhythmia that some patients were getting.
Yeah.
At the
As a side effect to this.
Medication.
Medication.
Yeah. So at the levels that I was at high levels of this medication, they were now realizing that there was these heart problems that were occurring. So I went in for to get that tested. I, of course, had that. And it wasn't affecting my life yet. So we went off that, and then I tried a new one. And same thing, like it was just, by this point, by the new medication, which was actually an older medication that they retried,
Mm-hmm.
My doctor and I were just waiting for scientists to develop something new for me to try and hope that was going to be the one that was going to be the thing that changed my life. So I was primed. I was ready for trying anything that was going to potentially help. And in talking with Bryce, it seemed like it was a really good thing to try.
Yeah.
I didn't want to get high, though, so that was the big concern for me is I didn't want that to be my life. And he explained that you don't have to. That's not the goal. That's not what cannabis treatment is like.
Yeah. So you were it sounds like over a 14-year cycle that you obviously suffered quite a few different side effects. It sounds
Very
like
much, yes.
from all these different medications. How many medications were you on at any one time during that time frame?
Like at a given time, the
at
maximum.
any given time, yeah.
3 was the maximum I was ever on at one time.
Yeah, 3 different types of pills.
Yeah,
Three different types of pills.
Yeah,
And
two
what
different
were those?
2 different antidepressants and 1 anti-anxiety medication.
So 2 antidepressants and an anti-anxiety medication per every day.
Yeah.
Every day you're taking those 3 different pills every day.
Yes.
Yeah, and that was that pretty consistent for 14 years? Or?
Normally, we tried doing add-on like a second antidepressant a few times, and it wasn't effective.
Oh, so a couple times during the course of your treatment, you were trying to get a 4th in there.
A third.
A third.
So most of the time it was only 2, but we would try a third to see if that was going to be what would help.
Yeah.
It didn't, obviously. Yeah. Well, it kept me going.
Mm-hmm.
It got me to the point where I was able to find cannabis. So I don't begrudge what I went through because it got me to the point.
But it doesn't sound like when you first met, somebody who said, "Hey, there's another option, and it's cannabis." It doesn't sound like you were like, "Yeehaw, let's do this." It sounds like you're a little bit apprehensive, right? Because you're like, I don't want to get high.
Yeah, I was apprehensive because of that. Yeah. But Bryce introduced it to me in a very non-confrontational way.
Mm-hmm.
In dealing with mental health especially for so many years, because my mental health predates the 14 or this now 16 years, because I'd had high functioning depression up until then.
Mm-hmm.
So, but I've been hearing, "Oh, you've got to try this. You've got to try this. Oh, my aunt's cousin's dog groomer is on this."
Yeah.
So many times, and he didn't approach it that way, and that was the key.
Mm-hmm.
It was just like, "Hey, this is that people like us have found to be successful. Try this
as a cannabis treatment."
And then when I said, "Yeah, but I don't want to get high," it was just immediately, "No, you don't need to." So it was a very quick conversation to get past that initial apprehension of being high all the time, because I had a neighbor for years that had MS that was on cannabis, and that's just what I thought. I think that's what the majority of people think is that cannabis treatment is. The majority of people that aren't on cannabis think that it's just you're just deafening the symptoms and you're just high all the time to deal with it. That's what I had thought.
That was your perception.
That was my perception, because there was no information, no education to correct me on that. Especially at that point, it's getting better. 2.5 years, 3 years later, but but at the time there was nothing to counter that information in my head.
So let's go through that window. So when you finally decided, you said, "Hey, I'm going to give cannabis a try," right? What was that transition like for you? How did you approach me? If you could take me through kind of the early days of when you were trying cannabis treatment to where you are today.
Well, I would have tried it pretty much immediately, but the clinic that Bryce was going to be opening at the time wasn't opening until September-October time period. So at that point, I went and I talked to my family doctor, who was very supportive about it.
Oh, great! So you went to your doctor. You said, "Hey, I'm looking at cannabis as an option, and what do you think?" And your doctor was all over that. Very supportive.
Her and I have got a really good relationship.
Yeah.
I don't jump into fads. I do my research. So there was that from when he talked to me about it, and he kind of gave me a leaflet, because that would have been probably July. It gave me time to kind of do a little bit of research on my own and figure out whether or not this is the newfangled thing that everybody's trying, or if there is some serious science behind it, and at the very least anecdotal information saying that this would help me. And at that point, then I'd had enough time to kind of gather my information, went to my doctor. I actually expected, even though her and I have an amazing relationship and she listens to my suggestions, she knows that I look into things and I don't just jump in. I was still shocked that she was that supportive. So she was incredibly supportive, immediately wrote me the referral to the clinic, and then I was actually able to get in and get my prescription before they even officially had their grand opening and open the doors. So when I started, I had already had quite a bit of my own information on what to do, but I was still, like, I've learned so much since then that I look back to those first few days where I was excited when I rolled my first joint. And I took a picture of it because I was a non-user. I had maybe tried it maybe a half dozen to a dozen times prior.
In your entire life?
In my entire life,
wow,
recreationally. So I knew that I got high very quick and very easy because of the 6 to 12 times I tried it recreationally. So that was where I really took to heart the low and slow.
So what was your goal? Like when you got your prescription, and I'm assuming you're obviously you're still on other prescription.
Nope.
No, maybe not at
the time.
No,
very
at
much
the time, right? Yeah. But I'm just wondering what was your goal when you lit up that first joint in your mind,
My goal, well, I tried not to get my hopes up, so I didn't have big goals. Basically, it was, let's see if I have any adverse reactions, which I didn't, and let's see whether or not this can give me anything to help me. And almost immediately, within the first week, it was incredibly encouraging, the results that I was getting. I was able to stop taking my anti-anxiety medications, or antipsychotics is the formal name for them. Almost like immediately with proper tapering according to my family doctor and everything.
So you sat down and made a plan with your physician.
We made a plan that if it does work, that the next step would be tapering off and then monitoring. So I was monitoring myself daily. So I was checking to see whether or not, if this was a better day than the day before. Or not necessarily tracking day to day, but week by week, because there's always fluctuations between day by day. So I was tracking week by week, but almost literally immediately. I think within the first week, I started tapering off of my anti-anxieties, and within that first probably 3 weeks, we started tapering me off my antidepressants.
Wow.
The anti-anxieties I was able to go off quite quickly because of the half-life and how fast I was able to withdraw off of it. The antidepressants took quite a bit longer to safely get me off of these medications without having a tailspin happen. So at that point, then it was a matter of lowering my antidepressant dose and upping my cannabis consumption.
So that was a very delicate process, so to speak, for yourself.
Right? Yeah, because I didn't want to because we're dealing with mental health, you can send yourself into a tailspin quite quickly. So I wanted to make sure that I wasn't setting myself up for failure by getting too ambitious and doing that. And then physically, like the physiological symptoms of withdrawing off of antidepressants are quite hard.
Have you gone through that before?
Yeah.
Did you ever try to cold turkey go off them, or
no?
No,
because I knew logically that was hazardous to my health. To do that. But yes, I had gone off because I had been on about probably a dozen, maybe not that many different antidepressants over the years. So I had to withdraw them.
So you've gone through this transition
of
with
going
other,
off
with other
and
medications.
Going on.
So when you're...
It was a little bit different with this because normally I was doing apples to apples, so I'd be doing an SSRI withdrawal and an SSRI increase.
Okay.
So
it's just a slightly different
So
brand.
With SSRIs, I'd have to decrease it enough that then I would start taking the new one at that dose and then raise it up. You don't want to overlap those. With this was different. I could overlap it, and my goal was to completely eliminate SSRIs out of my system. So it was a little bit different there. I had already had something previously that had happened called SSRI discontinuation syndrome, which is rare. It's not common. It's not uncommon, but it's not common. And it's a severe reaction to eliminating SSRIs out of your system. So it starts after the last dose. So I thought I was doing really well. Everything was going fairly smooth. I would decrease this, increase cannabis, decrease, increase, until my very last dose. And when I hit that last dose, and then the half-life of that, so when it was fully eliminated from my system a few days after, my body went into kind of like shock, basically. So
It's
severe
it was
withdrawals.
severe withdrawals. Yeah,
It's not
your body was looking.
Yeah.
Where is
Yeah,
my,
it was grasping
my,
for something. It's not
where's my compounds? Right?
with antidepressants. It's not considered withdrawals medically. It's
Yeah.
considered discontinuation, because you're not craving the drug. You're craving the relief of the symptoms that are caused by the side effects, right? So that lasted for quite a long. I couldn't drive for probably 3 weeks.
Oh my gosh.
Because there's something called electric shock sensation.
Yeah.
Brain zaps, and it's like your brain is. It's not like a physical feeling of like the electricity, but your brain kind of goes like this.
Yeah.
So you lose vision.
It's a nervous system reaction.
But it comes from the brain, and so I couldn't watch TV, I couldn't read books, I couldn't drive, I could barely walk for probably the first 2 weeks. Like it was extensive, but the thing that kept me going was the fact that I had already had such great gains with cannabis, and that I did not want to have to go back to the regular side effects that I was on. That weren't as bad as the brain zaps, for example, but they weren't fun. So it was knowing that I had something that was working kept me going through that. So it took about 2.5 months for that fully to stop. I still get brain zaps though, and I probably will the rest of my life.
Yeah.
So I don't get them, like I was getting them pretty much constant during those first couple of weeks. Now I get them maybe once or twice a week. I'll get 3 or 4 brain zaps before I'm falling asleep. But I'm willing to deal with that versus being on the medication again, because that would be the only thing that would stop that.
So what is so I guess let's bring that to where you are today. So where are you at today in your general life? How your career, personal life, like
night and day.
Night. Okay. Yeah.
It's absolutely night and day. There is anybody that knows me. That knew me prior. So there's people that knew me prior to debilitating mental health. So the people of 18 years past, right? And then there's the people that met me during, and then there's the people that met me after cannabis. And it's interesting to see the reactions from the different people, because I explained to people that have met me, post cannabis, that I would not know you if not for cannabis, because my life drastically changed. That first year was a struggle because there was the discontinuation, and there was a couple, just dealing with change, and then because I'm no longer chemically numbed, I had to deal with the whole range of my emotions coming back. I didn't realize how muted they were. So regulating these emotions, where now I'm experiencing highs of happiness and lows.
And you're like, what is this doing here?
Yeah,
you're
I'm crying at YouTube videos, just sobbing that the kitten was rescued or whatever it may be. And whereas a year before I would be
I cried
oh, that's sad, and I would maybe shed a tear, but I wouldn't be like because I had to relearn a lot of those things, because so much of it had been muted. And then in addition to it helping so much with my mental health, it also helped with me physically, because a lot of the symptoms that were non-mental health symptoms, so physiological symptoms like IBS, joint pains, things like that are manifested from depression or PTSD, they were treated. So things that I didn't even know could be treated by it were. And then things like, I've got quite a few injuries. I used to ski race, and so I have quite a few, I've got knee and shoulder and back and neck, and I've got those injuries. So it helped so much with that as well. So it's not just that I was able to get up off the couch mentally, I was physically able to get up off the couch. And that was a huge perk that I didn't expect. I didn't expect the physical benefits that I've experienced from it. So now I'm in this last year, especially my 40th, because I just turned 41 in February. So my 40th year was really my year of living again. And I traveled to Europe again by myself for the first time since this all happened. I went to festivals. I went on camping trips. I went to birthday parties and club nights. And
you weren't doing much of that for
No.
14 years?
Well, the most I would do in a year would be do family functions, and once a year on New Year's I would go to a friend's condo for their house party.
Wow. Yeah.
And now, like it's absolutely night and day. It's going from 0 to 1,000, and it took that first year of kind of relearning to live, and then this last year, my 40th year, where I really was like, you know what, I'm going to do it now. I'm making myself a goal, and I'm going to live, and then living. So I'm physically, like, I'm doing. I could never go to the gym. Like, I just mentally, I need that. I need an accountability partner kind of thing. So I signed up for things that that encouraged me to keep going and get physically active and strength train and stuff like that. So I'm not just happier. I'm happier and enjoying life and living it. I'm the poster child for success with cannabis.
That's an unbelievable story, Carolyn, and I mean, congratulations on getting your life back.
Thank you.
And that's amazing. All right, Carolyn, thank you so much. I appreciate it.
Thank you for having me.
Thanks for coming.
If you're a medical cannabis patient trying to understand which variations work best for you and your conditions, don't forget to get the Strain Print app and use promo code Stewart Farms to start tracking all of your cannabis intake. The more you use the app, the more points you will receive. You can redeem these points for Stewart Farms merchandise. Happy tracking!